Imagine this. You just turned 65. You signed up for Medicare. You feel relieved and protected. You think your healthcare is finally taken care of. Then one day you walk into your pharmacy to pick up your blood pressure medication, the same medication you have been taking for years. And the pharmacist tells you the total is $450. Out of pocket. Because your Medicare does not cover it. You are confused. You are frustrated. You thought Medicare covered everything. But nobody told you about the one missing piece that millions of seniors discover too late. That missing piece has a name. It is called Medicare Part D. And by the end of this video you will know exactly what it is, how it works, how much it costs, and most importantly how to make sure you never get caught at a pharmacy counter without the coverage you need. Let us start from the beginning. In our last video we talked about Medicare Part A and Medicare Part B. Part A covers hospital stays. Part B covers your regular doctor visits. Together they are called Original Medicare. But here is the problem, and this is the part that shocks most people. Original Medicare does not cover prescription drugs. Not one single prescription. Think about that for a moment. Most Americans over the age of 65 take at least one prescription medication every single day. Some take 5 or 6 different medications. And Original Medicare pays for none of them at the pharmacy counter. Zero. This is exactly why the government created Medicare Part D back in 2006. Part D is a standalone prescription drug plan. It is completely separate from Part A and Part B. You have to sign up for it separately. It does not come automatically with your Medicare. And this is the mistake that costs millions of seniors thousands of dollars every single year. They simply did not know they had to sign up for Part D on their own. Now let me explain exactly how Part D works in simple plain language. Medicare Part D is not run directly by the government like Part A. Instead, the government approves private insurance companies to offer Part D plans. Companies like Humana, Aetna, United Healthcare and others all offer their own Part D prescription drug plans. You choose one of these approved plans and enroll in it. Each Part D plan has what is called a formulary. Do not let that word confuse you. A formulary is simply a list of medications that the plan covers. Every Part D plan covers different medications at different prices. This is why it is so important to compare plans before you choose one. You want to make sure the specific medications you take every day are on the formulary, meaning the covered list, of whatever plan you choose. Here is how the costs work. When you are enrolled in a Part D plan you will have a monthly premium, that is the amount you pay every month just to have the coverage. In 2026 the average Part D premium is around $35 per month. Some plans cost less. Some cost more. It depends on the plan and where you live. You will also have a yearly deductible. In 2026 the maximum Part D deductible is $615. That means at the start of each year you pay the first $615 of your drug costs yourself before the plan starts helping. However, many Part D plans have a lower deductible or even no deductible at all, especially for lower-cost generic medications. Medicare Part D has coverage stages and understanding these stages will save you a lot of confusion and money. Let me walk you through each one simply. The first stage is called the deductible stage. This is the beginning of the year when you are paying your drug costs yourself until you meet your deductible. Once you meet your deductible you move to the next stage. The second stage is called the initial coverage stage. This is where the plan starts sharing the cost of your medications with you. You pay a copay, which is a fixed amount, or a coinsurance, which is a percentage, for each prescription. The plan pays the rest. For example, you might pay $10 for a generic medication and the plan pays the remaining amount. The third stage is called the catastrophic coverage stage. In 2026, this is a brand new improvement that helps seniors significantly. Once your total drug costs reach a certain amount in a year, Medicare caps your out-of-pocket drug costs at $2,100 for the entire year. This is a massive change that was recently introduced to protect seniors from extremely high medication costs. Before this change, some seniors were spending thousands and thousands of dollars on medications every year with no limit in sight. Now here is something extremely important that you must pay attention to. Medicare Part D has strict enrollment deadlines. If you miss these deadlines, you will face a financial penalty that follows you for life. Let me explain this clearly. When you first become eligible for Medicare at age 65, you have a 7-month window to sign up for Part D. This window starts 3 months before your 65th birthday month and ends 3 months after your birthday month. That is your initial enrollment period. If you do not sign up during this window and you do not have other creditable drug coverage, meaning coverage from an employer or union that is as good as Medicare Part D, you will be charged a late enrollment penalty. This penalty is 1% of the national base premium for every month you went without coverage. And here is the painful part: you pay this penalty every single month for as long as you have Part D. For the rest of your life. We are talking about a penalty that could cost you hundreds of extra dollars every single year simply because you missed a deadline. The moral of this is simple. Sign up for Part D as soon as you are eligible. Even if you are healthy right now. Even if you take no medications today. Because the penalty for waiting is not worth it and your health situation can change at any moment. Now here is something most people never find out until it is too late. Every year between October 15th and December 7th there is a special period called Medicare Open Enrollment. During this window you are allowed to switch your Part D plan to a completely different one for the following year. Why does this matter? Because drug prices change every year. The medications on your plan's covered list change every year. And your own health needs change every year. A plan that was perfect for you last year might be costing you 3 times more this year for the exact same medications. During open enrollment you can compare every available Part D plan in your area side by side at Medicare.gov. You just enter your zip code and your list of medications and the website shows you exactly which plan covers all your drugs at the lowest possible cost. Seniors who do this comparison every single year during open enrollment save an average of $300 to $700 per year on their prescription costs. That is money that stays in your pocket simply because you took 30 minutes to compare plans once a year. Let us do a quick recap of everything we covered today. Medicare Part D is a separate prescription drug plan that you must sign up for on your own. It is not included automatically with your Medicare Part A and Part B. It covers your medications at the pharmacy counter. It has monthly premiums, a yearly deductible, and different coverage stages. In 2026 your out-of-pocket drug costs are capped at $2,100 for the year. You must sign up during your initial enrollment window to avoid a lifetime penalty. And every year during open enrollment from October 15th to December 7th you should compare plans to make sure you are getting the best deal. If this video helped you understand Medicare Part D more clearly, please tap the subscribe button right now. Every single day on Medicare Made Simple we publish a brand new video breaking down Medicare, senior health, and retirement benefits in plain simple language that anyone can understand. No confusing jargon. No complicated terms. Just the facts you need. Your next step, watch our next video where we explain Medicare Advantage, also known as Part C, which is a completely different way to receive your Medicare benefits that millions of seniors are choosing instead of original Medicare. You will want to know about this before you make any final decisions about your coverage. I will see you in the next one. This video is for informational purposes only. It does not constitute medical, legal, or financial advice. Medicare rules, costs and plans change annually. Always verify current information at medicare.gov or speak with a licensed Medicare advisor for your personal situation.